Guideline 21.C.7, Aftercare, will be reviewed over the next 4 slides. Aftercare visit codes cover situations when the initial treatment of a disease has been performed and the patient requires continued care during the healing or recovery phase, or for the long-term consequences of the disease. The aftercare code should not be used if the treatment is directed at a current or an acute disease. The diagnosis code is to be used in these cases. Exceptions to this rule are codes Z51.0, Encounter for Antineoplastic Radiation Therapy, and codes from subcategory Z51.1, Encounter for Antineoplastic Chemotherapy and Immunotherapy. These codes are to be first listed, followed by the diagnosis code when a patient's encounter is solely to receive radiation therapy, chemotherapy, or immunotherapy for the treatment of neoplasm. If the reason for the encounter is more than one type of antineoplastic therapy, code Z51.0 and a code from subcategory Z51.1 may be assigned together, in which case one of these codes would be reported as a secondary diagnosis. The aftercare Z codes should not be used for aftercare for injuries. For aftercare of an injury, assign the acute injury code with the appropriate 7th character for a subsequent encounter. The aftercare codes are generally first listed to explain the specific reason for the encounter. An aftercare code may be used as an additional code when some type of aftercare is provided in addition to the reason for admission and no diagnosis code is applicable. An example of this would be the closure of a colostomy during an encounter for treatment of another condition. Aftercare codes should be used in conjunction with other aftercare codes or diagnosis codes to provide better detail on the specifics of an aftercare encounter visit, unless otherwise directed by the classification. Should a patient receive multiple types of antineoplastic therapy during the same encounter, code Z51.0, Encounter for Antineoplastic Radiation Therapy, and codes from subcategory Z51.1, Encounter for Antineoplastic Chemotherapy and Immunotherapy, may be used together on a record. The sequencing of multiple aftercare codes depend on the circumstances of the encounter. Certain aftercare Z code categories need a secondary diagnosis code to describe the resolving condition or sequela. For others, the condition is included in the title. Additional Z code aftercare category terms including fitting and adjustment and attention to artificial openings. Status Z codes may be used with aftercare Z codes to indicate the nature of the aftercare. For example, code Z95.1, presence of aortocoronary bypass graft, may be used with code Z48.812, Encounter for Surgical Aftercare following surgery on the circulatory system, to indicate the surgery for which the aftercare is being performed. A status code should not be used when the aftercare code indicates the type of status, such as using Z43.0, Encounter for Attention to Tracheostomy, with Z93.0, Tracheostomy Status. An example of aftercare Z code on our previous slide scenario, 87-year-old female presents for a fitting and adjustment of her hearing aid. The coding path would be fitting, hearing aid, and our code for this scenario would be Z46.1. Please note the coding guidelines for a list of aftercare Z category codes.